Today guys, we are discussing the cranial cavity of the skull, the internal or the cranial cavity of skull. The cranial cavity is divided for convenience into the anterior cranial fossa, middle cranial fossa and the posterior cranial fossa. Each fossa has its own boundaries. Number 1, if we see the boundaries of anterior cranial fossa, there is frontal bone on its anterior side and posteriorly there is the lesser wing of sphenoid. These are the lesser wing of sphenoid. And if we see the middle cranial fossa, anteriorly there is lesser wing of sphenoid, that is the posterior boundary of your anterior cranial fossa, and posteriorly there is, this one is the Petrous part of temporal bone. And if we see the posterior cranial fossa, this is the Petrous part of temporal bone and posteriorly there is the occipital bone. First of all, if we discuss the anterior cranial fossa, the bones which make the floor of the anterior cranial fossa is the ethmoid bone, the frontal bone and some part of the sphenoid bone. First of all, there is a foramen at this point. This is known as foramen caecum. This one. This is the foramen caecum and this is the ethmoid bone as a whole. This is foramen caecum. The projection in this is the crista gyli and these on the sides are the cribriform plate. This one is the cribriform plate. This is the crista gyli. The cribriform plates have small nasal pits for the olfactory nerves because the ethmoid bone is in the nasal cavity. Secondly, this is the orbital plate of your frontal bone in the floor. These are two canals in this cribriform plate. Because this is ethmoid bone, so the canals here are the anterior ethmoidal canals and posterior is the posterior ethmoidal canals. This part is the orbital plate of frontal bone and this part is the lesser wing of sphenoid and the point here is the jugum sphenoidi, that is the part of your sphenoid bone. These are your clinoid processes. This one are your clinoid processes. Now, if we discuss the middle cranial fossa has interiorly the lesser wing of sphenoid, these glenoid processes and the base of your jugum sphenoid, and posteriorly there is the Petrous part of temporal bone. First of all, these on this side, this is the Hypophyseal fossa that encloses your pituitary gland. On below this hypophyseal fossa is the dorsum sellae. These dorsum sellae has two projections, like these are anterior glenoid processes. These two projections are posterior glenoid processes. The canals in these are the optic canals. These ones are the optic canals. And if we tilt here, these are the optic canals and this one below the optic canals, these ones are the orbital fissure. This is the superior orbital fissure. If you see from the norma frontalis, this one is the superior orbital fissure that is adjacent to the optic canals. Now, if we see the floor of the middle cranial fossa, this is the greater wing of sphenoid and this part is the temporal bone. This one is the Petrous part of temporal bone. There are some foramens in it. Number 1, this is the foramen rotundum, this one. And on the either side, these are the foramen lacerum. This is foramen ovale. This is foramen spinosum, the small one, lacerum, ovale, spinosum. Okay, and on the Petrous part there is the internal acoustic meatus. If we see the posterior cranial fossa, it is interiorly bounded by the Petrous part of temporal bone and posteriorly by the occipital bone. On the posterior surface there is a large foramen that is known as foramen magnum, and anteriorly these are two canals. This is the anterior condylar canals, or this is also known as the hypoglossal canal because hypoglossal nerve, that is the 12th cranial nerve, passes from it.